Advanced Sports Medicine, what's going on? How you guys doing today? Hope you guys are all doing well. Hopefully, I think you guys had a Mastery Connect assessment yesterday, which is today for me, but yesterday for you guys because you're watching this on Thursday. Anyways, hope it all went well. Hope you guys' week is going great. Time's just flying by. I know some of you guys play some spring sports, so I know about the news about it officially being canceled. Sorry to hear about all that, obviously. But just hang in there and try to stay as positive as you can. On a positive note, so I'm going to start kind of interjecting some extra credit stuff in here. And then I'll have you guys email me the extra credit pieces. Okay, so that's all I'm going to really say about it. All right. So hey, look, we're on to something else. Again, I want to keep the pace. You know, I want to make sure you guys don't get bored. Okay, so now we're moving on to the next one, lower body pathology, which is kind of straightforward, just like upper body pathology, pretty easy stuff. So first off, we're jumping in with anatomy review. We already did a lot of this. So we're going to move on to some newer stuff, which is the hip joint, the knee joint, and the ankle joint. All right. So your hip joint is called your acetabulofemoral joint, acetabule or acetab, and then femur. Okay, so your acetab that pertains to your acetabulum, and that part is the socket in pelvic girdle. I'll show you in a second. And then the femoral, obviously the femur. So that's like the ball. Okay, so real quick, see if I could find it kind of quickly. All right. Oh man, this is not going to be. Let's do it this way. This one will be quicker. This one is just bones. Man, look at that skeleton. It's pretty cool. All right, so let's hide this. Okay, now look, see that socket right there? That's your acetabulum, right? This whole thing is your acetabulum in your pelvic girdle. It's actually made up of 3 bones. All right, so that's your acetabulum. See there, it's pretty cool. Okay. So acetabulofemoral joint, that's the name of your hip joint. Your knee joint is your tibiofemoral, pretty straightforward. Tibia and femur come together, make up your knee joint. And then your ankle joint is your talocrural joint. So your talocrural joint is your ankle joint. And then just like in the hand, you have a metatarsal phalangeal joint, a proximal interphalangeal joint, and a distal interphalangeal joint. So just like in the hand, you have the same thing in your foot. Okay. Let's see. Anatomy of the knee, right? So let's talk about a couple of ligaments in the knee. So we got the ACL, PCL, MCL, LCL, and meniscus. So this is pretty straightforward, right? So your ligaments provide stability, right? Ligaments attach bone to bone and provide support. Each one has a certain direction of support. So your ACL prevents anterior translation, and that's all this is translation of the tibia. So your ACL prevention prevents anterior translation of the tibia. Your PCL prevents posterior translation of the tibia, and your MCL prevents medial. LCL prevents lateral. And your meniscus is like a shock absorber, right? So let's see this 1, 2, 3, 4, 5. So ACL, so 1, PCL, 2. MCL is 3, LCL is 4, and then your meniscus is 5. And you have a medial and lateral meniscus. Yeah. So there's the anatomy of the knee joint. I think a lot of you guys can already know some of this. Okay, now some of the stuff you might not know now is the ankle ligaments. All right, so we have lateral ankle ligaments. So these prevent inversion, which is rotating your pes medially. So you have three main ligaments. So you have your anterior talofibular. So talofibular, you break that word apart, it attaches to your talus, or talus people call it, and your fibula. Your talus is a tarsal bone, and it's in between your tibia and your fibula. So you got an anterior talofibular, posterior talofibular, and then a calcaneofibular. So you break that down, and that's calcaneus, which I'm sure you all remember as your heel bone, and your fibula. This one right here, number one sprained ligament in the body. Okay, that's extra credit for one of the extra credits. So anterior talofibular is number one ATF, number one sprained ligament in the body. All right. And then you have your medial ligaments. So that's on the inside. Really super, super uncommon. This only gets like 12% of ankle injuries. That's number two extra credit. All right, that's the two extra credits. So medial ligaments get sprained about 12% of the time. Okay. And the name of that, it's really just a deltoid complex. We're not going to break it down ligament by ligament. We'll just call it the deltoid complex. All right, moving forward. Here, look. Here is the anterior talofibular, calcaneofibular. Let's just do this. Like that's any better. Oh my goodness. Anterior talofibular anterior, oh my. Don't be laughing too much. Okay, so anyways, well, it's all three of them right here, right? So posterior talofibular, anterior talofibular, and calcaneofibular. All right. And then here's your deltoid ligaments. So you don't need to know those all individually. We're not going to do the muscles. Ooh, we are doing blood supply. All right, so your abdominal aorta. Here, so let's, so 1, 2, 3, 4, 5, 6. And actually, so your abdominal aorta comes down right there. Branches off to your femoral artery right there, huge, right? So that's why, like, if you fracture your femur or dislocate your hip and it impinges on that, you're in trouble, right? Popliteal is a word for behind the knee. So actually, I did this nice posterior view for you. Popliteal. Tibial is also, I'd say, a little bit more on the posterior side. And then perineal is lateral or peroneal. And then your dorsal pedal pulse, which is like right there. Okay. So that's the breakdown of the blood supply. So abdominal aorta branches off into the femoral, to the popliteal, to the tibial, to the perineal or peroneal, and then dorsal pedal pulse, or dissalis pedis pulse. Okay. So that's the blood supply. And then on to neurological, just like the upper extremity, same thing with the lower extremity, okay? So we have the lumbar plexus, which is L1 through S1, and then sacral plexus, which is L5 through S4. Okay, let's go into this. So dermatomes, there's not, I'll post a video for you guys, but this is basically it for just the notes, right? So your L1 is superior anterior femur, L2 is anterior or mid femur, L3 is knee area, L4 is medial crust, the whole medial crust, L5 is lateral crust and dorsal aspect of the pes, and then S1 you start on the Achilles, go on the lateral aspect of the foot, and then to your pinky toe. Okay, so those are the dermatomes. Myotomes, I think it's a little easier maybe than the other one. So myotomes would be L1 hip flexion, L2 hip flexion, L3 knee extension, L4 dorsiflexion, L5 toe extension, S1 plantar flexion, and then S2 knee flexion. So it's you just go straight down the leg, right? So knee flexion, or hip flexion, knee flexion, ankle, and so on. Like these lines mean anything to you. Anyways, all right, so that's the first go round of lower body pathology. I hope you guys enjoyed it. I love you all, miss you guys, and we'll talk to you soon.